Well, an analysis of residential aged care finances by Leading Age Services Australia last week put the number of aged care providers at risk of insolvency at just shy of 200, with any closures set to affect 50,000 ageing residents these providers then care for. That's 200. Now, in statistical terms, that's almost a quarter of Australia's total nursing home population. To say the sector is reaching crisis point is an understatement. Joining me now for more and to understand some of the complex background here is Chief Executive Officer at Leading Age Services Australia, Mr. Sean Rooney. Sean, I know this is a complex area and it's one of those areas a bit like superannuation. Until you know someone going into care, you know, you're looking after an older person yourself or you're getting to that time in your own life, you don't really consider it important to delve into the detail. But of course, when it's upon you, the complexity of the system is mind-boggling, and the urgency, I guess, of needing to understand it, to look after people that you love becomes really, really important. Let's start with the numbers. So you say there's 200 providers around the country at the point almost of insolvency. That would affect 50,000 Australians, the 50,000 Australians they look after, which is about 25% of our population of people in residential care. That's pretty damning information. How did it get so bad?
Look, you're right, it is damning information, and we think this is an issue of national concern. What I think we're seeing, if you take a step back, is fundamental settings in the aged care system, be that policy, regulation, and in this case, funding. All of those settings have not kept pace with the changing needs and expectations of the growing numbers of older Australians. And so we find ourselves in a position where we are having to speak out to say that we are concerned around those 197 operators that we believe are operating under significant financial distress. Because what that means, when we've surveyed our members, they tell us that 4 out of 5 of our members say that financial pressure is constraining their ability to effectively meet the needs of the people they're caring for. And that's in nobody's interests in this country.
Now, and some of the history here, correct me if I'm wrong, is that when Australians previously went into residential care and were supported in institutions, not necessarily at home, as we know with home care packages, they were going in younger. And so you were amortising the cost for the provider between those that needed what we used to call high care and those that needed low care.
Yeah.
Now we're going into homes so much later in life. I think I saw a statistic recently, you know, closer to our 80s as opposed to our 70s. And look, living at home is a good thing, but when you're going into care later and older, the urgency and the need and the complexity of the care required is much more expensive. So the costs per resident have escalated, sometimes making the economics for providers pretty tough. Is that a fair assessment?
That's a pretty good summary of the situation. I mean, what we see is, as you've said, people have aged in place in their homes. They're coming into residential aged care. Average age of entry is about 85. And what we see is those people coming in have higher comorbidities, higher level of acuity, which translates into higher care needs, which translates into higher costs. And as I said up front, the subsidy provided by government to meet those costs are not keeping pace with the actual cost of delivering that high standard of care.
Okay, the government subsidy we know is about $65,000 per person. There's other costs individuals contribute to themselves. That works out, I think you said to me, at about $230 per day for someone in residential care. What does that money buy, and what do we need to do to increase that sum rather than just hitting up older Australians? How do we increase that funding?
Well, I mean, we've looked at the average cost per day. So the actual subsidy is around $231 a day. That covers costs for meals for the day, accommodation, laundry services, other activities and entertainment, as well as all clinical care and services. Now, to put that $231 a day into some context, if you're operating a hospital, you'd be receiving somewhere between $1,300 to $1,500 a day to provide the clinical care and similar services. And so what we're now seeing, and it's writ large in the interim report from the Royal Commission, is that the current system settings with regards to delivery of services to meet those more complex and chronic care needs those settings haven't kept pace with the cost of doing that, and that's now writ large in some of the appalling stories we've seen playing out in the Royal Commission.
One of the other issues, of course, is the demand on places, support packages for in-home care, so people could stay at home longer, are absolutely outstripping supply. So demand's outstripping supply. Now, the Prime Minister says, yes, we've got money on the table, we want to increase allocation of these packages. But a lot of the case, the argument is that we can't find sufficient carers to look after people and provide these services in homes. You know, we allow visas for people to come to Australia to work as au pairs, like nannies in homes, 6 months at a time. There's never been an agreement to allow aged care workers to come in and provide residential services. Why not?
Well, look, there are some immigration programs where we've advocated to have access to those overseas workers in areas of need, both in terms of clinical need but also geographical need. And this is something that we've been promoting heavily with the government recently, because what we do know is getting the workforce right is fundamental to getting care right. And what we have today is a workforce that is feeling overstretched and undervalued. And so it's in everybody's interest to make sure that we're providing all the supports we possibly can to make sure we have adequately trained and competently skilled and well remunerated people delivering care to vulnerable, frail older Australians.
Well, Sean, what happens if any one of these 200 providers that you say are on the brink of insolvency, if they go under, what happens to the residents in their care?
Well, we're already seeing this. So recently we've seen 3 providers in rural communities having to call in the administrators. That process then looks at, well, what are the options for care for those residents if there's nobody willing to take over the operations of those facilities. And to be honest, if they're financially stressed, that is challenging for another operator to want to come in and actually take over those services. Therefore, particularly in rural communities, there may not be another provider able to do that in that location. So the residents will then either have to return to their home in the community or have to move to an alternative community, often you know, an hour or 2 or even longer away. Now, that's what happens to the residents, and that's obviously not in their interests. But then you have the staff who will be out of work. And the multiplier effect of residential care facilities in rural communities can be significant, because they're not just directly employing people, they're also supporting the local general practice or the local chemist, as well as shops that are providing food and products and other services into the facilities. So this is a significant issue that cuts to the heart of not just aged care, but supporting older Australians to age basically in the communities that they know and love.
All right, before we go, I want to ask you, the Minister, Richard Colbeck, Tasmanian Senator, what sort of response have you got from him?
So we've been engaged heavily with Minister Colbeck, and he's well aware of the issues and he acknowledges this. We've put forward a package, what we've called the Working While We Wait package, and it's a nod to say that whilst the Royal Commission goes about its fundamentally important work to ensure that we have a better aged care system, we know that that's going to take time, and there's a number of things that we can proceed with right now. One of those things is indeed a funding injection of $1.3 billion into the residential care sector to ensure that operations can continue to meet the needs of the people they care for, whilst also looking at a transition program for providers that are either unable or unwilling to continue to operate. We need to have a mechanism that enables the people they care for to be properly looked after, and then to find alternative care arrangements or an alternative provider to take on those services. And in addition to that, we're also looking to see the government respond to that home care wait list that you mentioned earlier. And thirdly, support the aged care workforce. We have a workforce strategy that needs to be enacted in order to make sure that we have adequately skilled and appropriately remunerated people delivering care.